Good. So there. So right here. So now as I do this, it's going to start exposing where the hips are tilted to. So now look at your knees. Which one's back more? The left one, right?
Left.
Because the left hip is higher. Even though the right hip is jammed up more, it's pulling the left hip higher. They both get kind of compressed to the body. Now it starts to expose what's really going on here. So as we do this, they're going to straighten out on their own. Good. I'm going to do about 10 more of these.
This probably does look really funny if anyone else looks.
Yes, it does. Good. So she's squeezing her. So I'm pulling her muscles apart in the front, the quads, just so you all know what I'm doing here. So don't try this at home unless you're really, really communicating with the person you're with and you're taking your time. Because, look, they can stop you. She can squeeze her quads and stop me. But maybe she's got some tension in the knee here and I push too much. I'm pressure against the knee because she's not free enough to move. Sometimes you get that you're too tight in the front and right here you get locked up. Scar tissue or just too much tension in the hip somewhere is not allowing us to fully stretch. That's usually where meniscus or knee issue happens anyway because you're trying to bend the knee, but the front's not stretching enough to allow the knee to bend. So as this contracts, this stretches, right? So if you're in a position for it not to release, that's when you start getting damage or pains, drama. One more, good? Great, relax. Okay, so she's gonna pull both her knees to your chest. No hands, everybody does it, it's all good. Pull it there, pull your hand, knees in. Now it's gonna pull, so pull back a little harder. Good. Can you pull a little harder? Sorry, no, it's fine, no, easy. So she's right there, so as I'm looking, I'm feeling I'm pulling a little bit more on the right side here, a little bit more on the left side here. Relax a little bit, so I'm gonna position myself a little better for my sake. Because this is, you gotta do some self-preservation. So here, so I'm gonna pull it through. Now I'm following what I know through experience, but also her body's also gonna tell me what goes on. So right here, we're stretching the hip flexors as well as the hamstrings.